So I have really four main items here. And the first one is employee pay. Over the past 2 years, I've heard from multiple department heads around turnover of employees. Obviously, the workload this past year has been we haven't seen that before, so that's something obviously we need to take into consideration. But when a department head is almost in tears because she can't keep people, that really makes me think, how can we do something significant? Like, what are the changes that we can think of outside of the box to make sure that our employees are paid what they're worth? And I know that you guys are working on that, so that's nothing new, right? The other part of that, though, is the reimbursement for education. Now, this might fall under employee pay, or this could fall under mental health services, but there is a significant shortage of behavioral health and professionals in almost every area of Sedgwick County. So I wonder what initiatives are being developed to address this shortage. And so I'm looking for ideas, looking for ways to support, collaborate, to attract and retain talent, and develop the behavioral health workforce here. I know you guys are working on that too, but I just am going to say it. So my next topic would be mental health, obviously, substance abuse. Some of the facts and figures sitting on the Mental Health and Substance Abuse Coalition for the past 2 years. If we take these are sort of national numbers, but if we were to take them here in our community, we could round up some numbers. 19% of adults experience or have experienced mental illness. 9.7% of the youth in the U.S. are severely depressed. 10.8% of Americans with mental illness are uninsured, so we take care of a lot of those folks here. 40 million Americans ages 12 and older have substance abuse issues. 1 in 5 high school students have substance abuse issues. So that, I think some of those stats, especially the youth-oriented stats, show us that these problems are not going away. And so right now, in the time that we're in, how can we consolidate services in a location that are easily accessible? And so, with Tim and Joan and all the folks in ComCare and all the folks in our social services, can they shoot for the moon? What would they bring back to us if they could solve the problem? Knowing that it's a big chunk and a huge, huge thing to try to solve, and I don't know that it'll ever be solved, but we had WSU conducted a high utilizer study. So 519 high utilizer patients received $56 million in care. 30% of that, $17 million, was funded through public and uncompensated care and assistance. So how can we, out of those 519, those are just the high utilizers. So out of all the other folks that are here in our community that are utilizing our services, how can we get them back to buying homes, buying cars, being able to pay their rent? Here recently, my dad doesn't live here, but he was put in handcuffs and taken to the hospital. And I tell you that not for sympathy, but luckily, hopefully that isn't happening here in our community, but he needed mental health help. He's not a criminal. He needs behavioral health needs. He needs rehabilitation. And so I wonder, out of the people that we're servicing in our community, how many people are really receiving rehabilitative services? And I know that we're doing what we can, but out of our $450 million budget, what can we do to ensure that we have allocated those resources to folks who will need them? Again, getting people back to where they can pay their rent on time, those basic needs. Hopefully we can get them to where they need to be through through their case management services, through making sure they have medications, all of those basic things that maybe we don't ourselves experience, but we probably know someone who is experiencing a mental health crisis. Now let's talk about substance abuse. When folks in our community want to get off drugs and they don't have the resources to do it, they've made a decision. I'm going to get off whatever I'm addicted to today. They walk into our crisis center and they're told, we've set an appointment for you in 6 to 8 weeks. That person needs help right when they need it. They also need a medical detox. How can we fund a medical detox for folks so they don't have to get off whatever they're addicted to cold turkey? I don't know if you guys have seen any of those shows talking about substance abuse, but that's a really hard thing to do. And if we're able to provide that in an easily accessible place, I wonder how we could move the needle. For the past 2 years at least, I've been talking about this, and I wonder, I know that my colleagues have been talking about it too, and so I know that there is support. I know that I've heard each one of these commissioners talk about their support for mental health, and I'm absolutely grateful that we see that. But I wonder how we can really move the ball, like how we can put our money where our mouth is right now in this budget cycle to start really helping the folks who are most vulnerable in our community. So that's mental health and substance abuse. The other thing in sort of correlation to that is our ICT-1 program. Bottom line is ICT-1 continues to excel at treating people in place, preventing ER visits, preventing ComCare visits. Now, the cost for this service right now, I think, is around $277,303. Now, that is a collaboration with our city partners, and I think that in turn, outside of the money it shows a good partnership between the two entities. 2 teams roughly would be $544,052, and that's a 7-day-a-week coverage. I think we know crisis in this community does not happen in the time frame in which the ICT-1 service is provided. It happens at any time. And what we're doing is treating people in place so they don't have to go to the ER. We're saving those ER visits. We're saving our ComCare visits and they're doing follow-up services for folks. Some of the numbers, we had 236 times a law enforcement unit was freed up. We see an increase in crime. And so if we're able to free up our law enforcement officers to deal with crime-related activities rather than mental health-related activities, I think we'll see a change. 122 times a fire apparatus was freed up. 165 times EMS was freed up. 523.99 resources freed up. I think while this program, ICT-1, might not be an initial cost savings and it might cost us money, I wonder what are the resources, when we talk about bottom line, how can we determine the cost of this program in resources rather than the actual dollar amount that it's costing us. I think it's important to understand how we can change the way we look at service, the way we look at providing the service to folks that isn't maybe a traditional way. ICT-1 is new. It's I think, what is it, in its 2nd year now, I think. And so it is relatively new. And so when we're looking at data, do we need to have a couple more years to see how it really is impacting our community? But I would be in favor of adding another team to that to ensure that we have 24-hour coverage for the folks in our community. Well, 7 days a week, not 24-hour coverage. And then finally, so this is my 3rd year here, and I am wondering how we can utilize a grant writer, a grant team of folks. With a $400 million budget, we have a significant amount of grants in all departments. And we could spend, way less time maybe figuring out how to write a grant that would produce more applications. Grant writers, a skilled grant writer will bring sharper focus to each grant, which increases the probability of receiving that grant. Grant writing is really time consuming. It's detailed work. It requires extensive research. And sometimes maybe our staff is overwhelmed with other things. I'd like to hear from some of the staff who write grants. And I wonder, from what I understand, we have different grant writers in each department that are handling their own grants. So most grant writers that are specifically just grant writers are in the know. They know about all kinds of grants available. They can produce the applications, increasing the likelihood of reward. Having a consistent and gold standard grant makes Sedgwick County stand out among the rest, which increases our ability to maybe get those grants. And so having one grant writer, I don't know that it's going to cut it for us. But like I had mentioned with our diversity and inclusion officer, they're not going to be able to do it on their own. They're going to probably eventually need a team of folks who are going to help them with this. But how can we utilize the money that's already out there that other grant writers are capturing for their counties? How can we get it to come to Sedgwick County? So not only just one, but consolidating all of those grant writers in all of our locations, in all of our departments, to have a sharper focus so that we can be sure to capture what's out there. So my 4 things are employee pay, mental health and substance abuse, ICT1, and a grant writer.